Minister Gull-Masty, thanks for joining us today. Let's start with the federal government offer of $47.8 billion in 2024 for long-term reform of First Nations Child and Family Services. By APTN's calculation, this plan is more than $10 billion less than that. Why is that?
As you can see, we have continued with our funding agreement. The original plan that was in place and offered in the first round on long-term reform is one that we have actually continued to fund the delivery of programs and services. So the balance in the amount is $35.5 billion. What we have added onto this plan, and what I'm really excited to announce, is we have responded to the requests of First Nations leadership and what they were looking for in the previous plan. Two things. One, their inclusion in regional decision making. Two, long-term funding commitment at $4.4 billion annually after the 10-year period. We've also reflected in our calculation and adjustment to include inflation, and the growth factors of communities, because we know that they're a rapidly growing population. We wanted to be sure that the tools and the services that we're offering as part of the funding process is going to meet their needs. In addition, we are looking to ensure that our new process is going to address the flexibility needed to allocate that funding, so First Nations can make decisions for themselves.
And this plan, though, it does not include the National Children's Chief Commission, which was elected by the Chiefs in Assembly in 2024 to work with the government to come up with a deal on long-term reform. I guess, why is this the case?
What we've done in our approach is we've taken the extensive work that's been done already, a lot of research, evidence-led, everything that is reflected in the original long-term reform final agreement, in addition to what we've learned in the process that we've engaged in with the Chiefs of Ontario and Anishinaabe Nation, and we've really amalgamated those two things and created a process where we are inviting community to participate in a new approach that is regionally driven, where they're able to define what their agreement would look like in terms of service and delivery. And we are also respecting the work that's undertaken as part of the national framework. So if communities wish to participate in a regional agreement, that door is open to them. But we're also looking to work with the National Children's Chiefs Commission, the Caring Society, the Assembly of First Nations, because we know that communities have different needs across the country. We're trying to create as many tools and supports as possible for them to take the pathway that they choose.
And I guess, can you give us more details of what this plan entails? You talked about it a little bit there, but what is the timeline for the government to be meeting with the various regions? And if not the Children's Chief Commission, who will the government be meeting with from each of the regions?
Thank you. I've had the opportunity to really do a very thorough analysis since I became minister. One of the things that was clear to me is that certain regions had expressed their desire to move forward on their own independent pathway. It's my objective as a minister to respect their authority as rights holders, to define what it is they wish to see in terms of long-term reform for their children. It's also my objective as a minister to continue remaining open and engaging with everybody who is part of the tribunal process. I had the opportunity to meet with the National Children's Chiefs Commission chair. I've met with the portfolio holders, the previous one and the new one, at the Assembly of First Nations. I had the opportunity to meet with the Caring Society, Dr. Blackstock. I expressed my intentions in all of those sessions to speak to the regional approach that's part of a national framework, with the context being that we want to ensure that the plans moving forward are defined by and driven and determined according to the needs of First Nations communities. How this approach is different is that we are empowering the communities to determine governance. We are also working with them in a new reporting mechanism where they can define indicators of success, what kind of outcomes they're looking to achieve. We've committed to long-term ongoing funding, which is a huge part of the ask in the last agreement negotiation. And we have also looked at, what kind of flexibility do we need to incorporate when we're doing evaluation? And it's a multiple stage evaluation, so you always have the opportunity to refine what it is that you're seeking to attain as an objective. And, like I said, since the beginning, I'm here and open to work with those who want to work with us. We have a mandate to fulfill. Every day that we continue, in this process is another day that a child is in care in a system that is not defined according to their culture, their identity, supported by their community. We have a mandate to fulfill. We have to meet that in a timely way. I want to be sure that communities know that I'm here to meet them with the urgency that is necessitated in this case, that I'm also here to make sure that I'm working with you so that you can determine that next step moving forward for what your nation's needs are.
And you mentioned multiple stages and timelines. I guess when will you have an agreement in place with all the regions?
Sure. I have already received multiple band council resolutions, letters of interest, communications from community that want to have exploratory discussions. I intend to engage with them in the beginning of the new year to see what that looks like. What does the format look like? Working with them to define a collaborative process and moving forward, what their needs are going to be. I really believe that giving space and ensuring that you're working with in a supporting manner what First Nations are trying to do is something that should be driven by them. I'm a partner in this process. I'm there to respect rights holders. I also have, the openness to see what does a regional agreement look like. Is it from a First Nations regional positioning? Is it multiple regional agreements per province? It really depends on how they want to organize themselves. I'm also ensuring that in our process, we are looking to engage at the provincial level what their role is going to be in this process, because we know that every relationship with First Nations differs from province to province. Their needs differ from province to province. When they are defining their care in community, wraparound services in community, when they are also leaving community to seek additional supports within the provincial healthcare system, that we are incorporating that as part of our work. So I'm encouraged by this, and I think that this is something that the Prime Minister has really defined and showcased as a strong relationship at the provincial government level, and I do think that he is, going to look to this as one of the agenda items in the upcoming First Ministers meeting.
We'll have to end it there, Minister Gull-Masty, but thanks again for joining us today.
Thank you, Miigwech.